Welcome back, everyone. You know, a lot of people consider having plastic surgery to help them look younger, and many of you may have heard of what's called the lunchtime lift. Dr. Ali Mosharrafa is here now to separate fact from fiction when it comes to these quick fixes that you say can sometimes turn out not so well.
That's exactly right, Carrie. And what I wanted to talk about today was many consumers are looking for a quick fix or a non-invasive facelift, and oftentimes they're misled. These procedures tend to be very expensive and often have either untoward or minimal results that doesn't justify the expense and the risk that they're taking. And
when we say lunchtime lift, a lot of these are billed as, hey, come in on your lunch hour, we can fix you up real quick and you look 10 years younger.
That's absolutely right. These are office procedures, first of all, so they're done under local anesthesia. They're called things like thread lifts, feather lifts, lunchtime or lifestyle lifts, and so yes, patients are essentially having them done in an office setting without proper supervision and sometimes without proper training by the people that are doing them.
Let's go ahead and take a look at some of the pictures that you provided to us. These are some before and after. Tell us what we're looking at here.
This first patient is a patient who came to me after one of these procedures, which was done by another physician here in town. She paid about $3,000 for an operation that essentially was to support the tissues and try to make her look younger in the face and neck area.
And this is what she looked like after she ponied up that $3,000.
That's correct.
Before she came to you.
That's correct. So what we did was I did a traditional facelift, which obviously is done in the operating room, to retighten the areas that had not been improved and also the gathering that occurred from her first operation, and tried to give her
You really see a noticeable difference there.
That's right, a more natural result. The next picture is going to be from the front. This is the patient also before and after. The before shows still gathering in the jowl area. The after shows her more defined jawline and neck area, which really was what she was looking for after the thread lift procedure, which was falsely promised to her.
Okay, and then let's take a look at the next patient if we could, and you can explain to us what happened with this lady.
This is another patient that locally here in town went for a minimally invasive procedure with a similar lift and liposuction to the area under the chin and neck area. And again, this procedure was billed as a minimally invasive office procedure, and after the surgery, you'll see that after a traditional facelift, she has a better contour to her neck, jawline, and this is a more traditional facelift, which we in plastic surgery consider to be the gold standard.
How much does a traditional facelift cost, ballpark?
Well, obviously that's going to be very regionally dependent, but here in Phoenix, the average range is somewhere between $5,000 and $8,000. So the micro-invasive or office procedures or minimally invasive procedures are about half that price. But as you can see, you can end up with results that not only are cosmetically unsatisfactory, but there are also some risks that are involved that I'd like to talk about as well.
Yeah, let's take a look at this. If you guys could pull up this still store for us. Take us through this, doctor.
Yes. The first one is facial paralysis. There are a number of facial nerves that control the muscles of the face, and when you're sticking needles and sutures blindly through the skin, clearly you're not visualizing what you're doing, and there is a risk, an additional risk of facial paralysis from these procedures. The gathering of skin, we know how the facial tissues age. It's something we study as we become plastic surgeons, and to simply grab a piece of muscle or skin and expect by tightening that you're going to somehow rejuvenate the face and make it look younger is unrealistic. And then finally, sometimes by gathering the muscle and skin, you can end up with ischemia or blood loss to that area of the face, which can lead to necrosis or partially unviable tissue or tissue that's lost its circulation, and that's another important risk that you take by doing this feather lift. There are some others that I wanted to just mention briefly. First of all, keep in mind that the people that are doing these procedures are not necessarily trained in managing some of these complications.
You have to look for doctors who are board certified and have hospital privileges. That is a huge deal.
Absolutely, and board certified by the American Board of Plastic Surgery, and also the hospital privileges is important because that's where we do peer review. That's where we judge and report complications and make sure that the quality of care is maintained.
And if something goes wrong, you need the doctor to be able to get into the hospital to help you out.
Absolutely.
Okay, Dr. Mosharrafa, just remind people where your office is at.
I'm on 3301 North 2nd Street, which is 2nd Street in Phoenix, just off of Osborne, south of Osborne, and obviously facelifts are a big part of my practice, and part of my job today is to educate consumers and hopefully steer them in the right direction so they can have nice results and make their investments worthwhile.
Well, I know that you've been named one of the top doctors here in Arizona, so I really certainly appreciate you being here with us this morning. Important information.
Carrie, thank you for having me.
Thanks.